Everyone, this is Abdullah Mansour. I'm one of the clinical teaching fellows working in the NHS, and I have my colleague with me today. This Ahmed Chetta is one of the clinical fellows in King's College. Nice to meet you, Ahmed.
I didn't get that.
Nice to meet you. Thank you, Abdullah, for having me. Thank you very much.
Yeah, thanks for joining me today. So today it's very kind of you to agree on doing this webinar for the MRCS candidates. So we sort of would like to know a little bit more. I mean, do you want to tell us your story that you've passed the MRCS recently? Or maybe...
So yes, I started my master's journey in February in 2020. I decided to come to the UK to do my new surgical training here and decided to do my MRCS as the first step to be GMC registered and join the NHS. I've done my first part of the MRCS as mentioned in January 2020, and then I passed my MRCS Part B in 2022 in May. And after that, I managed to join the NHS as a clinical fellow in trauma surgery in King's College Hospital just at the end of the last year.
Okay, that's excellent. Thank you very much. That's really helpful. So would you like to tell us more today about what we should do or what is MRCS, and maybe dig a little bit more into the resources and how can we study and what are the best strategy for it? So do you want to crack on and start telling us more about this?
Absolutely.
Right? Yeah.
Absolutely. So the first thing is that you must have the good reasons to have the good motivation necessary, because it's quite a journey full of some difficulties, some challenges that you have to overcome. Some of them are knowledge-based, some of them about culture-based, some of them are communication skills-based. So you have to have the proper reasons and proper motivation. And I think there are some reasons why a lot of people try to get their MRCS. The first reason is that if you want to come to the UK and work as a surgeon, as a doctor, you have to have what's called the GMC registration. And one of the options that will get you GMC registered is the MRCS. It's an accepted postgraduate qualification that can guarantee you a GMC registration. If you are planning to apply for surgery-related jobs in the NHS, it's very good and very powerful, very helpful to have the MRCS in your application form. It's always one of the desirable and sometimes one of the essential criteria of shortlisting. So having the MRCS will definitely help you in your application. If you are currently in the NHS already and you are planning to sit the MRCS so that you can apply for an ST3 training program, because it's always an essential component for all the ST3 surgery applications to have passed the MRCS, whether you have been in a core surgical training program or you have not been in a core surgical training program. Anyway, you will definitely need the MRCS to be able to apply for an ST3 training post. Even if you want to sit the FRCS the FRCS, or the Fellowship of the Royal College of Surgeons, is an exit exam for all the surgical specialties. Each specialty will definitely have its own different exam. Recently, I think last year or 2 years ago, it has been changed now that you must have passed your MRCS before applying for FRCS. That wasn't the case before, but that has started to change 2 years ago. And now you must have your MRCS before setting your FRCS. That's about getting the qualification. What I think is even more important is the content and the material of the MRCS itself will definitely help you to be properly functioning as a surgeon in the NHS, including all the knowledge-related components, the communication-related components, even the structuring of the conversation that you would have between your colleagues and also between your patients and their relatives. So I want you not to just get into preparing for the MRCS from the exam point of view, but also from experience and for lifelong practice in the NHS point of view as well. Because from my experience, the time that I spent during my MRCS preparation have significantly helped me to start my job as a surgeon fellow in King's College comfortably and quite aware of the basic structure of the communication and of management protocols. These are the main reasons why you want to do the MRCS. Maybe you have more than one of them, but it's always good to understand that the MRCS will definitely help you in more than one way, whether on the short term or even on the long term as well.
Yeah, that's excellent. So I think the take from that slide is that it's pretty much essential, whether you're going to be like a training registrar in surgery or a non-training registrar. So it's sort of essential, whether like you want to be a consultant as well. So it's mandatory to have MRCS at this stage of your life, right?
Absolutely right.
Yeah, great.
And let me also clarify something else very important, is that the MRCS is two things at the same time. It is a diploma in surgery that you obtain by passing the exam, and it's also going to give you the membership of the Royal College of Surgeons, which are two separate things. the MRCS diploma will get you the membership, but they are not essentially related. You can have the diploma without being an active member of the college. You don't have to become a member to have your MRCS. They are two separate things. But of course, to use that, we'll discuss later in the part about how can we do GMC registration with the MRCS, the details of what to do after you passed your Part B and you finish the diploma.
Great. It's really interesting that you mentioned that it's a diploma. So is it considered like a postgraduate degree or?
It is definitely a postgraduate qualification, and it's on a specialist qualification. If you want to go and do an EPIC verification, it's a special qualification, and it is a diploma in itself. Absolutely, yes.
Okay, excellent, great. Yeah. Maybe next slide.
So for the MRCS Part A, I understand that a lot of people would be more, thinking about doing the MRCS without getting a lot of details, but I'd like to start with the MRCS Part A. What are the essential components that you can pass the MRCS Part A confidently? So these are the essentials, which means that they are a must. You cannot just work one of them without the other. At the same time, you can still have other stuff that can support your preparation. First of all is books. You must read, you must study for the MRCS. You should not rely only on question banks. And I recommend these books. The Essential Revision book is one of the books by Past. It's quite concise. It's very helpful, very reasonably written. And it's very helpful if you combine it with also doing the MCQ question banks. Raftery is a basic science box. Will cover anatomy, pathology, microbiology, and some applied surgical sciences as well. So it's very helpful if you want to review all these medical school-related topics in a reasonable way. It also has some oral questions at the end of each chapter, which is also a good preparation for Part B. I definitely recommend Raftery. I've read Raftery twice before sitting my MRCS Part A, and I think it was a very useful experience. I've done something that a lot of people don't really do. It's a pre-test pathology book. It's one of the books that people study for their USMLE. And I've done these for pathology specifically. Actually, few questions from the exam came from the pre-test, and I was happy that they were there. But I don't think it's absolutely necessary. If you want to have more, if you have more time and you're more willing to do some pathology, I think pre-test pathology book is a very reasonable choice. Online question banks are a must. I didn't give particular names because they are all useful. Nobody failed or didn't make it because of the question bank, and nobody really makes it because of a specific question bank. It's all about what you do with these question banks. So the function of the question bank is not give you the exact questions that will come in the exam, which sometimes they do. But the most important part is getting you exposed to certain topics that are particularly essential. So the most useful thing is that you use the bank to point toward the most important topics that you need to cover for your MRCS. So what I do is that I combine reading the books with question banks and coming back and forth so that I strengthen my understanding and memory. Fawzia sheet is not a particular sheet, it's a dynamic sheet that changes every few years. So we make sure that you have the latest one that has the right answers. It's one of the most common essential MRCS questions that show up again and again in the MRCS exam. Part A, really recommended. Do not get into the exam without reading Fawzia sheet at least twice. So recalls is quite something that it's about the previous exams. They can sometimes manifest themselves in the Fawzia sheet. Sometimes they manifest themselves in the question banks. It's also about having more exposure and learning about the most common trends in the exam recently. And these are the most essential parts. If you want to do all of that, it will be very reasonable that you will pass your MRCS with good score. I've tried this particular combination of resources with myself, with more than one of my colleagues, and it's worked quite perfectly. All of them got very significantly high scores, and they were all satisfied with it.
Yeah, that's interesting. Just before you move on, so I have tried the same resources and I found them really helpful as well to pass my MRCS Part A as well. So I just want to ask you, I know you've done your MRCS Part A early on in your career after you graduated from medical school. So how did this feel? Like in terms of, in another way, what is the right time to do the MRCS, whether Part A or Part B?
So the way I think about it is remember this Chinese saying that the best time to plant a palm tree maybe 10 years ago, but the second best time is now. So it's definitely trying to do Part A as soon as possible. It's always good to do MRCS after finishing medical school immediately. I've actually read a paper that says people freshly graduating for medical school are more likely to succeed and also to have higher score in the MRCS more than people who pass sit the MRCS later on in their career. However, at the same time, it's not particularly wrong. It just means statistical difference. That doesn't necessarily mean that you should not sit it later on in your career. You can still sit the MRCS if you do the same preparation, doing the same resources. You'll definitely have a very high chance of passing the exam. Okay. But of course, sit as soon as possible will always be my advice.
Okay, that's great. Thank you.
So some stuff that you do not do in the MRCS Part A under any circumstances. You do not do MCQ without reading and studying the topics. This will be like a recipe to failure because MCQs, whatever they are, they will not match what comes in the exam. And if you don't have a real deep understanding of why this particular choice was the right one and why this one was the wrong one, you will not be able to consistently answer questions correctly when they are presented in different format. So what I think is you have to always combine reading books and texts and studying with answering questions, because it's always going to be very tempting to just answer a question and then press next and enjoy that satisfaction of I'm getting some green answers and some red answers and I'm trying to progress. That's not the way to progress. Always combine both. The second thing that you should not do, you never rely on one single source because sources complement each other. So it's the highest chance of getting more questions answered in the exam if you get through more than one resource. As mentioned before, you have to combine all these different sources at the same time. And as I mentioned, don't spend too much time reading without doing the MCQ because it's also wrong. Doing MCQ alone is wrong, and reading alone also is very wrong. I've made this particular mistake early in my preparation. However, I was early also corrected by one of my colleagues. That's why the fourth and the most dangerous thing is do not do it alone if you can. If you have colleagues, if you have partners, if you have friends who can help and prepare with you, it will be very useful. It's not just give you motivation, it gives you structure and makes you aware of things that you may miss otherwise. So combine resources, combine different methods of studying, do your MCQ in addition to reading, and do not work alone if you can, of course. These are the most do not do stuff in the MRCS Part A, according to my experience. If you'd like to share, Abdullah, as well, your experience with Part A, we'd much appreciate it.
Yeah, I completely agree with you. I sort of like followed the same plan mostly. So I think, yeah, I started by reading at the beginning, maybe for 2 times, and that was again combined with the MCQ as well. So for example, I'll start reading the anatomy first, I'll read as much as I can, and then I'll move on to do some questions that are related to this particular part of anatomy, and I will come back and do it over and over again. Yeah, so and also I read as much as I can really. I remember maybe like at least like 3 or 4 times. It's not necessarily that everybody has to do it 3 or 4 times. I think maybe 2 times with questions and the readings will be enough. But I mean, I was very skeptic before the exam. That's why I was very keen to do it multiple times. And yeah, I end up getting pretty good a score with that preparation. But I think that the score doesn't really matter as well. It's just like a pass and fail exam. So yeah, very good.
I totally agree. It's my only take about the score is that it's about safety, because one single score, if you pass a particular margin, it's quite risky. So it's always having more score will protect you against any statistical changes or statistical differences that happen because of other people scoring. Because 60 or 70 today, maybe 72 tomorrow, maybe 73 later on. So always aiming for a higher score will even protect you even more. So that's my in terms of course, it's all definitely a pass and fail exam, no doubt about that.
Yeah.
Right. So for the MRCS Part B, which is quite different from MRCS Part A, I'll discuss basically the important components. There is a knowledge part and there's a skills part. And the knowledge part is 3 stations of anatomy in which you would be given a photo, a colored photo with numbers on it, and you're supposed to recognize the structures numbered. There's 3 stations, different body parts. It's always important to cover everything, and it's not a big deal. And also one of the easy stations to get high score in. So usually anatomy is a safe station for you. Pathology, we have 2 stations of pathology, which will be presented as a case or a photo or an investigation, maybe an ECG. It's going to be like a quite variable 2 stations, also very useful to prepare for the pathology using the material of the MRCS Part B specifically. Applied surgical sciences and critical care is also testing knowledge about surgery and critical care. Will be presented with case scenarios in which you will be asked questions about your diagnosis, your management, your plans, and also some basic science related to it. The skills, which is the reason why the MRCS Part B is so different from MRCS Part A. There are 3 stations of clinical examination. You will be asked to examine a certain part of the patient's body. You have to do that in a systematic way according to the record surgeon way. There are 2 procedural skills or 2 stations in which you'll be asked to do some procedures with your hands that can be suturing, maybe knot tying, maybe catheterization, maybe abscess drainage, maybe nevus excision. There are multiple stations that you need to be familiar with, and all of them are quite common in everybody's surgical experience, so it's not particularly complex surgery or anything like that, just simple procedures that demonstrate your safety and your easiness and your flow and your smoothness with dealing with surgical equipments and surgical instruments. Communication skills, these are information giving stations in which you will be discussing some content with someone. That can be either a patient or a relative, in which you'll be giving them information, and you are handling and managing the response to these information you are giving to them, or you're discussing some case or some patient's condition with a colleague, in which you will be giving details, answering questions, making recommendations, and so on. And the last 2 is going to be history taking. You'll be asked to interview 2 patients who present with 2 different complaints. And these are information gathering stations in which you are asked to collect this information, also in a structured and systematic way. The reason why the MRCS Part B is different from MRCS Part A, because some challenges are unique to it, unlike Part A. So Part B also have knowledge. So knowledge is common between the both. And as much as you study and prepare, you'll be fine. It's only these things that are a little bit different. The communication skills are essential. There are no communication skills, obviously, in MRCS Part A, but in Part B, it's present, and it's present in every station. It's not only in the communication station that our communication skills are essential. They are essential, and they are graded, and they are important in every different station you're dealing with a patient or dealing with a colleague. So it's very important that you understand that these communication skills are manifesting themselves properly throughout your entire exam. Okay. The second thing is that the exam will be given entirely in English. So you will be asked to speak English and to listen to it and communicate in English, which is different from Part A. So you must be a little bit familiar. You have to practice your station properly, to practice your language properly, and to repeat stuff in a reasonably natural way so it sounds smooth and normal. There are some technical skills. It's not only knowledge and communication, but also you're asked to do stuff with your hands. So you must have some experience and some practice doing these procedures. And there is also a Royal College of Surgeons way of doing clinical examination. If you go on PubMed and search, for example, MRCS knee examination or MRCS shoulder examination, you'll find a paper that discusses how to do the examination according to the Royal College of Surgeons way. And that's the way the Royal College will be accepted, and this is the way they are graded. So there's a certain way to do the examination. That's why it's very useful to use material coming from the UK, coming from the NHS, coming from people working in NHS, so that they give you the way that is accepted in the UK. Not that the other one is wrong, but it's only about the grading that is based upon satisfying certain criteria. The other thing is also very important that people who sit the exam come from either NHS or non-NHS experience, and people with NHS experience will definitely have some advantage because of their understanding of all the different details of the exam. They will sound more familiar, more confident. They will know the different terminology. That's why it can be a little bit challenging for non-NHS candidates, but it's also still possible for you to just pass the exam with your knowledge and skills as long as you do the preparation, putting in mind that you do it in the NHS way as mentioned before. And for the MRCS Part B, unlike Part A, you do not have an option. You must have a partner. In Part A, you can still do it without a partner, but Part B, you cannot. You must have a partner with you in Part B so that you can practice both the communication skills and the other knowledge-related topics. I think these are the main differences, and they are important because while you're preparing for Part B also has books. So you think it's also going to be studying books and doing questions. It's not. The preparation is different. It's less time of you sitting to the chair, sitting to the table or your desk studying and reading, more than dealing with the person, either examining them or talking to them or discussing with them and answering their questions or asking them questions. That's the most useful part. And from my experience, I've made that mistake a little bit, and I wasn't really sure until I changed my strategy completely. And I had a partner throughout my preparation who helped me significantly prepare for the exam. And that's how I got a high score after doing that specific change.
Yeah, can I just take you back for the previous slide just to ask a quick question? So the previous one, the one that has the stations. So now looking at them, there are 20 stations. Are all of them counted towards your final mark, or are they normally 20 stations or 18 stations?
So there are always some stations that are called pilot stations, in which the Royal College is examining the exam. It's giving a station to test whether this test or whether this station can be used later on to give you marks, because it's used to figure out whether it's a differentiating station.
Okay.
So what happens that, let's say, 10 people go to the exam and 5 of them got high score and 5 of them got low score, okay? So that means that the 5 are different from the other 5. If they do differently in the station, or they all do well in the station, so it's not very differentiating station, right? The station must differentiate people with knowledge and skills and those who don't, so that it can really filter. If it's too easy, so everybody is passing it, it's not right. And if it's too difficult, nobody's passing it, it's also wrong. So it has to be giving this middle differentiating quality that makes it a good exam, can differentiate good candidate from not so good candidate, or prepared versus not prepared candidate.
Okay. And just to clarify also, how long does every station last? Is it like 10 minutes, 9 minutes? Or?
So it's 9 minutes each. Some of them are 9 minutes complete, and all the communication stations are 9 minutes. Some of them are divided into 6 minutes and 3 minutes. The clinical examination stations and history taking stations are 6 minutes and 9 minutes. There are also 2 stations which are, it's not actually stations, more than 10 minutes break, in which you're going to be preparing before each stage. For example, if you're going to go and talk to a patient in a communication station, you will be given 9 minutes to read their notes so that you know what you're talking about.
Okay.
Or if you're going to talk to a colleague, so you'll be given also 9 minutes to prepare and go do your presentation of the case also in 9 minutes. So and there's also 2 stations of break in between. So you'll be spending at least, I think, like 3.5 hours or 4 hours in the exam venue, doing either the exam, knowledge or skills, or breaks in between.
Okay, sounds good. Yeah, thank you.
So these are my essential tools for preparation for MRCS Part B. You must join a course. It's not optional. You have to find an online course that will provide you with explanation, with mock exams, with feedback, with technical or procedural skill stations in which you can practice. Find a hands-on course before the exam, a few days before the exam. You must join a course to make your presentation systematic, make your examination systematic as well. And it's very good to have non-medical partner for examination history taking, so that you avoid using medical jargon during your presentation, during an examination. And I did have that. It's very helpful. I was very careful with using this medical terminology and also sticking to the layman language that will be understood by non-medical professionals. If you have a medical partner for the communication with colleagues stations, that would be great, so that they can understand, they can ask you questions, they can challenge you, and also can give you feedback. So if you have a non-medical partner for this part of the exam and having a medical partner for communication with colleagues, that would be great. Doing as many mocks as possible is never too bad. Do as many as you can, as often as you can. It's very helpful to put you in the mode, makes you understand what are your weaknesses, and also gives you a motivation to better prepare next time. Because everybody has their the parts of the book they don't really study, that they try to avoid, that they try to ignore, they assume will not come in the exam. Mock exam confronts you with reality and pushes you towards reading and studying these parts that you would usually miss or ignore. And you have to take every chance given to you to practice the Royal College Surgeon way as you work in your hospital, in your clinic, in the operating theatre. Whenever you examine a patient, try to remember to use your MRCS way of examination. If you want to do a certain procedure, always remember to do it in the root cause decision way. If you are in the clinic, you have to communicate with the patient. Remember always to communicate in this way. So your practice comes actually from reality, which will sound much more confident and much more professional.
Great. So when you say do as many mock exams as possible, do you really focus on the clinical skills or the knowledge instead? Like, I mean, or both of them?
So if I have to choose, well, definitely clinical would be more important. But if you have time to do both, definitely both would be very, really useful and very, very good for you to practice and also to test yourself so that you don't have any delusions about your knowledge. At the same time, it will give you comfort because if you are good at them and doing very well, it will boost your confidence and will even motivate you even more to your exam. So I really recommend doing mock exams for both clinical and for knowledge as well.
Okay, sounds good.
So these are the don'ts in the MRCS Part B. Do not study the material without practice. It's completely useless. Don't just get a book and read the clinical examination steps and memorize them. This will not help you at all in the exam. And do not say, I will do it well in the exam. You won't. You will have to, when you go to the exam, you must have done this at least 10 times before. So that it sounds and it looks very confident and very comfortable and very smooth. Remember, this MRCS exam is essential that you can work as a registrar. So it must have some a manifestation of confidence and of experience in it. You have done this many times before, and you are confident about doing it. And even if you have some defects, you are self-conscious and you know them, and you try to correct for them. That's not wrong. That's absolutely right. As long as you are not particularly consumed and anxious while you're doing it. Looking natural and smooth and confident will definitely give you a lot of scores. Do not assume that some stations aren't that frequent. Some stations are not actually that frequent, but you will never know. Some of them will actually show up on your exam. So don't make that assumption. You have to study all the stations and always be prepared. It's never wrong to be too prepared. There's nothing actually is a too prepared preparation. If you make that assumption when decisions show up, it will be not very comfortable for you, and it will definitely affect the entire other station. Remember, you can still fail on a station and succeed, but if you fail on a station and do poorly in one another station, unfortunately, your chances of success will be significantly less. So it's very good that you avoid this mindset. Sometimes, and I think it's absolutely against the GMC recommendation and against the code of ethics. However, it happens sometimes that out of the exam, some of these stations are why does people know what kind of stations show up in the exam? Never use that at all, and do not rely on it. It's not going to be helpful at all. Your performance in the station is much more important than your knowledge of it. So ignore completely anybody saying anything the first few days of the exam. Continue as much as you have been going. Keep reading, keep studying, keep practicing, and do not pay any attention to this kind of, because it's a very common mistake. You will get caught up and you make assumptions and they go in the exam, the questions are completely different. And they have revised these topics like 1 week ago, and that will definitely impact negatively their performance in the exam. And as I mentioned before, in the MRCS Part B, do not attempt to do it alone. And if you live in a country where you have no real friends, nobody's free, or everybody is busy, join a group, join a course that does the MOX exam for you. You must always be in a community. You should never do the MRCS Part B alone. If you can, try as much as you can to be involved with other people so that you can perform better in the exam. Okay, so as mentioned before, the MRCS is definitely one of the accepted postgraduate qualifications and postgraduate certificates that definitely help you to get the GMC registration. Once you pass MRCS Part B, you will be sent an invitation to become a member. You have to pay the fees for the first time, and then you will be given a certificate. This certificate is either the big, beautiful, classy, lovely certificate that comes from the Royal College of Surgeons, but that takes a while. So if you want to do the GMC registration quickly, you have to ask for a certificate, a temporary certificate that says that you have been awarded the membership. It should never be in the future sense. It should never be will be awarded, because it will not be accepted by the EPIC for verification. It must be in the past tense. And then you take this qualification and send it through the EPIC for verification. When you go to the EPIC portal, there will be multiple options, whether it's primary medical qualification, it's postgraduate internship, pre-graduate internship. Choose the specialist qualification option. You'll find that in the big drop-down list of qualification that you can choose from. And then you ask the EPIC during your application to send the report, because what they do is they do a primary source verification. They contact the GMC, the College of Surgeon, and they ask them about whether this statement is true, and then they give a report to the GMC. You can ask them to send the report directly, and you can do that for free for the first time. So that's already part of your application. Once you do that, now the GMC has a report saying that your MRCS is valid, and that you can be incorporated in your GMC application in addition to your OET or language evidence, in addition to your primary medical qualifications and your postgraduate qualifications, like internship and training, and other documents that are asked from you to get the MCA registration done. All right?
All right, excellent.
So that's the MRCS.
Yeah, thank you very much. That was really helpful. So yeah, we went through MRCS Part A and Part B and your sort of strategy. So if there is any like a take-home message for everyone, so what would be your take-home message for everyone?
So for the MRCS Part B, actually it's 2 P's. It is partner and practice.
Okay.
You have to do both of these things. That's mainly it. If you have a partner and you keep practicing with them, this is the main issue. The MRCS is not difficult from the content point of view. It is from the performance point of view. If you're performing well, it's like a cinematic, artistic acting exam. You have to perform in a certain way. If you perform better, everybody's going to do the examination quite the same. It's not very variable. But it's about the quality of the performance and the easiness and how smooth you are. And that all comes only from practice. And practicing in this clinical setting is not enough. You have to practice specifically for the MRCS.
Yeah.
Understanding that you have certain type of patients and certain type of grading system that is used to judge your performance. So partner and practice. These are the 2 most important words in the MRCS Part B, in my opinion.
Okay, excellent. Thank you very much. That was really helpful. And
Thank you very much
for joining me today.
Thank you very much. Have a lovely evening.
Thank
Bye.
you.